Adrenal insufficiency is a diagnosis where the treatment literally keeps you alive, yet the language used in the clinic often makes patients feel like they're barely being seen. It's a gap between the medical reality and the human one.
It's that disconnect, right? On paper, everything looks fine. The labs are in range, the pills are being taken, but the actual experience, it's often a mess of fatigue and unpredictability that the clinical shorthand just doesn't capture.
We're looking at a piece from My Adrenal Life that breaks down these common phrases, the well-intended stuff that actually ends up being quite harmful. Like when a doctor says, "You're stable." To them, it means you're not in a crisis. To the patient, it can feel like a brush-off.
Exactly. Stable, in a medical sense, just means you aren't currently spiraling toward an emergency room visit. But the research shows that even when people are stable on medication, their quality of life, we're talking energy, mood, even sleep, is often significantly lower than the general population. A 2023 study in the Journal of Internal Medicine highlighted that current oral treatments fail to mimic the natural circadian rhythm of cortisol. So you might be stable, but you're still living in a body that feels fundamentally out of sync.
It's the not dying versus thriving distinction. If I'm not in a crisis, I'm technically stable. But if I can't get off the couch because of brain fog, that's not a version of stability I want. The article points out that this word, stable, can actually pressure people to downplay their symptoms. You don't want to be the difficult patient who's struggling when the charts say you're fine.
And it makes you question your own sanity. You start thinking, if the expert says I'm stable, why do I feel like I'm walking through wet cement? It creates this internal friction where you stop trusting your body because the language being used to describe you doesn't fit the reality you're living.
Then there's the just stress dose instruction. That word just is doing so much heavy lifting there. It makes it sound like flipping a light switch, but the reality is way more technical and, frankly, stressful.
It's a massive oversimplification. I mean, think about what it actually asks of a person. You have to be your own endocrinologist in real time. You're feeling symptomatic. Maybe you're coming down with a cold or you had a massive emotional shock. And now you have to decide, do I double the dose? Triple it? When? A study published in Endocrine Abstracts found that even with training, fewer than 20% of patients managed to correctly self-inject during a crisis. The decision-making process is a high-stakes cognitive load.
Wait, less than 20%? That's terrifying. It shows that just doing it isn't the problem. It's the complexity of the situation. You're already low on cortisol, which affects your thinking, and now you're expected to perform a medical calculation and maybe a self-injection while your body is literally shutting down. It's not just anything.
It's a performance under pressure, and the medical language treats it like an administrative task. Just adjust the dose. It ignores the fear, the doubt, the "is this enough or too much" anxiety. People are often afraid of over-replacement too, because long-term that leads to other issues like bone density loss or weight gain. So every stress dose is this internal debate.
I think the phrase that gets me the most is, "at least it's treatable." It's meant to be the silver lining, the reassurance. But when you say that to someone who's struggling with a life-altering condition, it feels like you're telling them they don't have a right to complain.
It's a conversation stopper. It frames the condition as solved, which is just not true. Yes, we have hydrocortisone, but as we mentioned, oral pills are a blunt instrument. They don't have that pre-awakening surge or the ultradian rhythms, those tiny pulses of cortisol that a healthy person has. A treatable condition is still a heavy condition. Research from the University of Bristol recently showed that even on standard therapy, energy levels are about 30% lower in the morning compared to healthy people. Treatable doesn't mean back to normal.
I don't know. I keep getting stuck on the idea that maybe doctors have to use this language. If they don't say you're stable, what do they say? If they don't emphasize that it's treatable, are they just being doom and gloom? Maybe this is just a limitation of the medical system itself.
I see that, but I think the article is arguing for a different kind of accuracy. It's not about being negative, it's about being precise. You can say, your labs look good, but how are you actually feeling day to day? That's a very different starting point than you're stable. One opens a door, the other closes it.
Right. It's the difference between checking a box and having a conversation. But if the doctor only has 15 minutes, they're going for the box every time. That's a structural problem. It's not just about mean doctors. It's about a system that values measurable data over lived experience.
Totally. And that's where the patient starts to feel like a data point. If the data point is in the green, the system says the job is done. But the person attached to that data point might still be unable to work full time or keep up with their kids. That gap is where the isolation happens. Qualitative studies show that patients often feel ignored or not listened to during adrenal crises because their symptoms are non-specific: nausea, fatigue, and if the labs aren't screaming, the doctors might miss the urgency.
That isolation has a real cost. The article mentions that people start downplaying things or questioning their own reality. If you keep hearing, "you're fine," from the people who are supposed to be helping you, you eventually stop telling them when you're not fine. You just retreat.
And that's dangerous. If a patient stops reporting symptoms because they don't think they'll be heard, they're more likely to miss the early warning signs of a crisis. It's a safety issue. The article is basically saying that better language isn't just about being nice. It's about better clinical outcomes. If we use language that aligns with reality, we get better information from the patient.
So, how do you actually navigate this? The piece gives some advice on translating this language. If someone says, "you're stable," you can internally say, "my labs are stable, but my experience still varies." It's about maintaining your own narrative.
I like that approach. It's almost like a mental shield. You aren't necessarily fighting the person saying it, because usually they are trying to be helpful, but you aren't letting their simplified version of your life become your own truth. It's about holding both things. They mean well, but my reality is more complex.
But isn't there a risk that by translating internally, you're still just absorbing the minimization? If I don't correct the person, the cycle just continues. I feel like there's a missed opportunity for advocacy there.
That's a fair point. But also, being an advocate for your own rare disease 24/7 is exhausting. Sometimes you just want to get through the appointment. The article suggests adding context when you do have the energy. My labs are stable, but my symptoms still fluctuate. It's a gentle way of expanding the conversation without making it a confrontation.
It's that collaborative tone they mention. You're not saying, "you're wrong." You're saying, "let me give you a fuller picture." It's a subtle shift, but it feels more empowered. It gives the patient back some agency in a situation where they often feel powerless.
Agency is the word, because adrenal insufficiency is all about management. You're constantly adjusting, checking, thinking. When the language used by others minimizes that effort, it feels like they're erasing the work you're doing to stay alive. Validating the difficulty isn't just about empathy, it's about acknowledging the labor involved in this condition.
The labor of staying upright. There's something almost sad about having to explain that to people. But I suppose the alternative is that silence when nobody understands, which is worse.
The article ends on this note of gentle empowerment. It's about giving yourself permission to feel that gap, to say, okay, they said I'm stable, and that's one truth, that my truth is that today was really hard. You don't have to force those two things to match up.
It's a weird space to live in, between what's said and what's real. But maybe just knowing that other people feel that same gap makes it a little less lonely.
I think it does. It moves it from being a personal failing, like, why can't I feel stable when I'm told I am, to a shared experience of a systemic issue. It's not you, it's the language.
If you're living with adrenal insufficiency or supporting someone who is, take a look at the full piece on My Adrenal Life. It's a powerful reminder that your experience is valid, even if the medical shorthand doesn't quite fit.
If this resonated with you, please share it with someone in your circle, maybe even your care team. It's a small way to start closing that gap.